Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking with pulmonary and critical care specialist, Dr. Michael Basha. Dr. Basha, how do you make the diagnosis of lung cancer?
Well, once you suspect lung cancer in a patient, the next step is going about making a diagnosis, and we have lots of different tools to make a diagnosis. We can use standard bronchoscopy, where we go down the patient's nose, down into the airway, and get biopsies that way. We can have our friends in interventional radiology do a fine needle aspiration under CT guidance. If there's fluid trapped between the lung and chest cavity, we can take the fluid out and analyze it in the laboratory. We might have to resort to a major surgical procedure called a VATS procedure or mediastinoscopy to make a diagnosis. One thing I do want to mention here is that we have a new technique here at this hospital called Electromagnetic Navigational Bronchoscopy. This is a tool that myself and Dr. Artinian are using to make a diagnosis of lung cancer much earlier. We use something called the VERAN system, V-E-R-A-N. And basically, patients will go for a CAT scan before their procedure. And we put these sensors on their chest. And these sensors will allow us to create like a three-dimensional picture of the lung, the airways, and the lesion. And we can see the lesion there in the right upper lobe of the lung in yellow there. And basically, this will allow us to create a map or a road map for us to be able to go through the airways and precisely identify the lesion. So you see there in the blue where the road map is taking us to this lesion there in the right upper lobe. And this is basically what we see when we go down into the airway. It provides basically just a direction. It's like a GPS system for the lesion. So we can see different views here. It helps map exactly where we're going. It gives us an airway to go precisely to the lesion. And so there's no missing the lesion once we're down there. This is the sensor device which creates the 3D dimensional picture for us. And here's the bronchoscope going through the airways, making the various turns all the way out very, very far deep within the lung that we couldn't do before, precisely to the lesion. Here comes the biopsy forceps, and it allows us to take a bite of tissue, and that goes to the laboratory for analysis. So with this technique, we can go out after very small lesions in the periphery of the lung that we previously could not get a biopsy from. In years past, what we might have to do is just repeat CAT scans every 4 to 6 months and determine whether or not the nodule or the lesion is changing size or shape. But now with electromagnetic navigational bronchoscopy, we can go after very small lesions and hopefully make a diagnosis early. And if it's a certain type of lung cancer, send the patient to the operating room for excisional surgery, which offers the patient a cure.
That's an amazing word to be used along with lung cancer as cure. So you actually make the decision then of which of these different diagnostic methods of getting a biopsy are the right way to do it.
That's right. Depends a lot of things. It depends on the patient's health. Can they tolerate a surgical procedure? Are they better off having a standard bronchoscopy under conscious sedation? Can they go to the operating room for electromagnetic navigational bronchoscopy under general anesthetics? Do they need a surgeon to do some sort of excisional biopsy or mediastinoscopy? So there's lots of different factors based on the patient, the lesion, where it's at, et cetera, which determines how we go about getting a biopsy.
Once you have the results from the biopsy, what does it tell you?
Well, it tells us the type of cancer, and as we mentioned earlier, we divide lung cancers into small cell lung cancers and non-small cell lung cancers. Small cell lung cancers, or what we used to call oat cell carcinomas or cancers, are not treated with anything other than chemo and or radiation. These are cancers which at the time of diagnosis have already spread and cannot be treated surgically. Non-small cell lung cancers, if they're diagnosed relatively early, and they're limited stage cancers, can be treated with surgery, and that would offer the patient a cure.
Now you use the word stage. Tell me about staging cancer.
Well, staging occurs after biopsy. So let's say we find a patient that has a lesion, we think it's cancer, we go ahead and do some sort of a biopsy as we've just talked about. Once we get a diagnosis of cancer and once we determine what type of cancer it is, small cell, non-small cell, we can go about staging the patient. Staging the patient means what we're doing is we're trying to find the extent of the tumor. Is it located just in the lung? Has it spread to lymph nodes? Is it outside the chest? Has it spread to distant organs such as the brain, the liver, the kidneys, the adrenal glands, the bones, etc.? And then that allows us to give a staging to the patient, and that will help us decide how to go about treating the patient.
After the biopsy report is given, and you've talked about this staging, at what point do you involve other physicians or other care providers?
Well, that's a very good question. And so depending on the type of cancer and the staging of the patient, we decide who we need to send the patient to next. So for example, if we get a diagnosis of small cell lung cancer, as I've mentioned just recently, we might just send the patient to a medical oncologist. If the patient has a bony lesion that might benefit from radiation, we may send the patient to a radiation specialist. If the patient has a non-small cell lung cancer, stage 1A or stage 1B or 2A or 2B, we might send the patient to a thoracic surgeon for excisional surgery and possible cure. So a lot of it depends on the type of cancer and the stage in terms of what other doctors we use to help us take care of that patient.
As you're talking about this, I'm thinking about the patient, and I'm wondering what kind of time frame are we talking about here to get this all accomplished?
Well, I think it's very important when you suspect lung cancer in the patient to move the process along relatively quickly, because obviously time is very important here. So we're talking just days and weeks sometimes to go from the process of the initial consultation in my office to getting some additional diagnostic testing, such as a CAT scan or a PET scan, to setting the patient up for a biopsy, getting the result, staging the patient, and sending the patient off to another specialist for definitive treatment.
So, because time is important both in treatment and in the patient's concern about what's going on.
Absolutely. So once you make the diagnosis, obviously the patient wants to move on to treatment as quickly as possible.
Well, we're going to talk all about treatment, but first we're going to break for this message.